well, then you're not going to perfuse your organs and you're not going to perfuse basically your entire body, and that can result in issues too. And so certain types of polycythemia, especially polycythemia vera, are actually treated by periodic bloodletting, which is super crazy. It's not that exciting because it's basically you just draw a lot of blood, but for some reason in my mind it sounds very medieval. But I think I've only seen 2 cases of polycythemia vera, and again, it's not very common. So then the other half of what can happen to red blood cells is anemia. So anemia is, by definition, a reduction in the number of red blood cells. And there are a few causes, blood loss being one of the most common, so internal or external bleeding. Hemolytic anemia, which you talked about before, which is your body hates its red blood cells and it starts destroying them, and that can be due to an inherent autoimmune condition. It can actually be due to some infections, so tick-borne diseases, leptospirosis, certain toxins, and then some forms of cancer. You can get what's called an anemia of chronic disease. So basically just the actual presence of chronic inflammation in the body results in a low-grade anemia over time. You can get an anemia of kidney disease. So the kidneys, one of the things they produce is erythropoietin. And if you think about it, erythropoietin sounds like erythrocytes, right? So erythropoietin is a hormone that tells your bone marrow, hey, it's time to make more red blood cells. And if your kidneys... That's my dog, in case you were curious. If your kidneys are not working 100%, then they are not going to produce enough erythropoietin, and your bone marrow is going to kind of start to forget that it's supposed to make red blood cells, so you'll get a mild to moderate anemia over time. And then you can have certain bone marrow diseases. Those can be immune-mediated, infectious, or cancerous, and they can negatively affect the bone marrow's production of red blood cells. And then certain cancers can cause anemia for a variety of reasons. Like if they cause bleeding, they can cause hemolytic anemia, and they can also directly affect the bone marrow, inhibiting production. And so we use the following items to help us figure out why we have anemia. And we're going to use clinical signs, and that's why a thorough physical exam is so important. We're going to use history, and that's why your veterinarian and their staff are going to ask you 1,000,001 questions. And we're going to use the reticulocyte count. So that is going to be the body's way of telling us it does or does not know that there's an anemia. We're going to use the size of the red blood cell, and we're going to use the amount of hemoglobin within the cells. So again, the pallor or color of the red blood cells. We're going to take all that information together, and we're going to come up with a fancy term for the anemia, which I will talk about more in a little bit. So let's go back to the reticulocyte count. Pardon me. So normal, right? Bone marrow, spleen, thinks there's enough red blood cells. Cool. If your reticulocyte is high, then the bone marrow spleen thinks that there's not enough red blood cells, and or you have that spleen squirt, right? I'm sorry, apparently there is another dog outside, which, as you know, is not allowed in the rules of Winston, my dog. There can only be one. So if the reticulocyte count is high, then the bone marrow or spleen, like we said, thinks that there's not enough, so it makes more. And if it's low, there are 2 possible causes. So in one instance, the bone marrow is trying really, really hard to produce red blood cells, but they're either being lost or they're destroyed. And this also assumes that the spleen has exhausted its supply of reticulocytes. And then the other instance would be the bone marrow is just not working for whatever reason, whether it's that the actual cells that would be producing the red blood cells have been destroyed or replaced by cancer cells. There can be a variety of reasons. So then we look at the MCV, or the mean corpuscular volume. Again, that's the size. So normal size red blood cells are called normocytosis, right? Because we have to make it sound fancy. And in the cases of anemia, that usually means that the bone marrow has no idea that there is an anemia yet. If the red blood cells are small, we call it microcytosis. And we can actually see microcytic or small red blood cells without anemia in certain breeds. So like Shiba Inus and Akitas. And that's not a pathologic problem. That's just being a Shiba Inu or an Akita. And in the face of anemia, you can see microcytosis with iron deficiency, which is probably the one that we think about the most. Certain liver shunts, chronic inflammation, copper deficiency, which is rare, vitamin B6 deficiency, which I actually didn't really know about until I was researching stuff for this, but it came up a lot, and I honestly do not ever remember reading about it in vet school. And then the red blood cells can be large, and that's called macrocytosis. And that's seen in blood loss, feline leukemia virus, which is an immunodeficiency virus, breed association. Again, that is not pathologic, and it's usually not associated with anemia. It's just some toy and miniature breed dogs can have really big red blood cells. Feline hyperthyroidism, so when the thyroid levels are too high. If they have folic acid or cobalamin, which is B12 deficiencies, and then some forms of leukemia and certain types of bone marrow diseases. Last, we talk about the pallor, so the color. So normochromic, normal color, normal amounts of hemoglobin, in instances of anemia is usually seen when the anemia first starts, regardless of the cause. And you can also see it with certain types of chronic anemia too. Hypochromic, so too little hemoglobin, you see with iron deficiency, vitamin B6 deficiency, again, learn something new, blood loss, and hemolysis. And then hyperchromic, right, too much hemoglobin doesn't actually exist. It's usually an artifact. The red blood cells can never carry too much hemoglobin. So if you see a high MCHC on the blood, honestly, you usually just ignore it because it doesn't actually mean anything. So now we have these terms, we have all these descriptors, right? So let's kind of put that into real case examples. So acute blood loss, within the first 72 hours, the bone marrow is not going to know that it happened. So you're going to have no reticulocytosis, right? So you're going to have no excessive numbers of immature red blood cells. You're going to have normal size and normal pallor. So it's going to be a normocytic, normochromic, non-regenerative anemia. If it's chronic blood loss, then you may have high reticulocytes if the bone marrow recognizes it and or if they can produce enough red blood cells before they get nom-nommed. In the case of hemolytic anemia, the red blood cells are usually big and they're usually pale. So we would call that macrocytic, hypochromic, either regenerative or non-regenerative anemia. And then the same thing fits usually with hemolytic anemia, except they are usually normal size. So we would say it's normocytic, normo or hypochromic, non-regenerative anemia early on. And then later, it can be normocytic or microcytic or macrocytic, right? So they can be any size they want, and they're usually hypochromic, so they usually have low amounts of hemoglobin, and they can be regenerative or non-regenerative. And then just to do one more, just because I know when you start listing these things, it just makes your brain hurt, but in the case of iron deficiency, and really copper and that vitamin B6 that I learned about today. So normally it is considered microcytic, hypochromic, non-regenerative. So that means that they're little and they're pale and there aren't a lot of immature red blood cells. So as you can see, we learn a lot about anemia just from the CBC. And if we have a patient that has normal red blood cell numbers, right, or high red blood cell numbers, we still learn a lot by looking at the size and the shape of the red cells, as well as whether or not there's reticulocytes. So now we're going to look at the white blood cells. I know, we're only on one part of the blood work, and we've already spent like 20 minutes talking about it. Yay! So there's 5 main white blood cells that we think about. There's your neutrophils. Those are kind of like your bacteria fighters. They're the most common white blood cell. Then you have your lymphocytes. Those represent your immunity. So when you probably all heard about, there's another dog in the world. You've all heard about B cells and T cells. And so they help regulate, like your B cells produce antibodies, your T cells help regulate your immune responses. Those are the second most common white blood cells. Then you have your monocytes, and your monocytes eat/destroy bacteria, but other infectious agents. They help regulate repair of tissues. They also help regulate the way your immune system responds. They're responsible for how the red blood cells turn over and for iron recycling. And then you have eosinophils, and these little guys, they're really pretty under the microscope because they have these little granules inside of them. And they are involved in allergic reactions, immune-mediated conditions, and then certain infections like parasites, fungus, nematodes, and protozoan. Oh, now you get to hear my cat. That's Ringo. And then basophils, they're weird. Like, to be honest, we don't know a lot about basophils, so I'm not going to talk about them a lot, and we don't really understand what they do, but they tend to increase in association with the eosinophils. So we think that they have similar functions to the eosinophils, but they're really kind of like the redheaded stepchild. Like, no one really puts a lot of thought into them. And so if you have an animal that has like a really high basophil count, then you usually spend a lot of time wondering, like, is this important? And it depends if there's eosinophils or not. So there's more questions than answers really about the basophils. So then we look at what each of those cells are doing. So the neutrophils, okay, if there's a lot of them, then it's usually infection or inflammation. If there are not enough of them, then it's either chronic infection or reduced bone marrow production. And actually, if the neutrophil count is too low, then they are considered immunocompromised because they don't have enough neutrophils to fight off a potential bacterial infection. And that's one of the huge things you worry about with dogs and people who are receiving chemotherapy. And there are these things called bands, and they are immature neutrophils, and they usually only get released if there's a pretty severe infection or inflammatory process. And so if you see bands, that's usually pretty significant. Lymphocytes, and I'm sorry, I'm not sure if I said this, but high neutrophil count is called neutrophilia. Low neutrophil count is called neutropenia. So then your lymphocytes, if they're high, we call it lymphocytosis, and that is usually due to vaccination, excitement, leukemia, or chronic ehrlichia. And then if they're low, we call it lymphopenia, and we can see that with stress, if there's certain disease conditions that result in the loss of antibodies. And some examples of that are like protein-losing enteropathy. So that's basically a gut disease where you lose proteins, you poop them out. And it's almost like the gut has these like big holes in it that are big enough that the proteins that normally should be kept in your blood kind of like squeeze through and then you poop them out. And so that's one example where you would kind of spontaneously lose antibodies. And then viral infections, and then there are certain genetic immune deficiencies. And then the monocytes, we really only see like monocytosis as an issue, and that's from stress, chronic inflammation, or tissue death. Monocytopenia is not actually a problem, and it's not very commonly seen. Eosinophils, they can be too high, eosinophilia, and that is usually parasitic infections, allergic reactions, or immune-mediated conditions. And then they can be too low, eosinopenia, which is stress responses. And there's this disease process called Addison's or hypoadrenocorticism, which is basically you don't have enough stress hormone in your body. And we'll talk about it in a different podcast. But one of kind of the things you look for, because Addison's is really nebulous and it's like the great pretender, so it can do whatever it wants. But frequently you'll have an animal that is sick and should have an eosinopenia because they're stressed and they don't. So that's really where the eosinopenia comes in, is because it's that one answer on that one test in vet school where you're like, Addison's. So there's 3 very common abnormal white blood cell patterns that we're going to talk about. And that is what we call the stress leukogram. Okay, so all of your white blood cells together are called leukocytes. And so the evaluation of all of the white blood cells are called the leukogram. So that's the pattern that they make. So a stress or steroid leukogram usually has a total white blood cell count that's normal. It will have a neutrophilia, so elevated neutrophils, no bands. It will have a lymphopenia, so low lymphocyte count. It will have a monocytosis, so elevated monocytes. And it will have low eosinophils, so an eosinopenia. And then you have what's called an inflammatory leukogram. And so that is the total white blood cell counts high. The neutrophils are high. Frequently there are bands. And then you'll have a lymphocytosis or a lymphopenia depending on the disease process. And then usually you have a monocytosis. In pancytopenia, that's the third pattern that we frequently see. The actual, the total white blood cell count is low. So we call that a leukopenia. And then each individual white blood cell is low. And that is most commonly seen with parvovirus in both cats and dogs. So now we're going to move on to the platelets. We're almost done, I promise. It's a long journey, but we're almost done. See, this is why I split it up, because I figured it would be too much if we did it all today. So platelets, really, you can have too many or too few. So if you have too many, it's called thrombocytosis, because your platelets are also called your thrombocytes. And you will see that with certain cancers, chronic inflammation or infection, lung diseases, hormone disorders, some heart diseases, some GI issues, some immune-mediated diseases, and then frequently right after bleeding because the body's like overcompensating.